What are new ways to stop COPD flare-ups from coming back? Imagine having a plan that not only treats your symptoms, but also helps prevent flare-ups from happening again. That's what many new strategies aim to do for people with chronic obstructive pulmonary disease. COPD flare-ups, also called exacerbations, can be tough on your lungs and your overall health. Thankfully, recent advances are giving patients and doctors more options to keep these episodes at bay. One exciting development is new medications that target the root causes of exacerbations. For example, a drug called ensifentrine was approved by the Food and Drug Administration in June 2024. It works as a dual inhibitor, relaxing airway muscles and reducing lung inflammation at the same time. This helps prevent wheezing, coughing, and shortness of breath. Another medication called dupilumab is now recommended for patients who still have symptoms despite using multiple inhalers. It works by blocking specific inflammatory pathways, helping to reduce the chances of flare-ups. Doctors are also turning to long-term, low-dose antibiotics like macrolides. These antibiotics do more than fight bacteria. They have anti-inflammatory effects that can lower the frequency of exacerbations. Patients who take these medications regularly often notice fewer flare-ups and improved quality of life. But it's important to use them under medical supervision to avoid resistance. Pulmonary rehabilitation programs are another key part of preventing flare-ups. These structured exercise and education programs help strengthen your lungs and improve breathing. Recent studies show that patients who participate regularly have fewer hospital visits for COPD flare-ups. These programs also teach you how to recognize early signs of worsening and manage symptoms better. Some researchers are exploring repurposing existing drugs like metformin, a common diabetes medication. Early studies suggest it might slow aging processes and reduce inflammation, which could help prevent exacerbations in older adults without diabetes. While more research is needed, this approach shows promise for future treatment options. The new guidelines introduced an easier way to assess how severe your COPD is. Instead of relying only on lung function tests, doctors now ask about how often you have flare-ups and how bad your symptoms are. This helps tailor treatments to prevent future episodes more effectively. Personalized care is also gaining ground. Instead of a one-size-fits-all approach, doctors now focus on your specific traits and modifiable factors. This method has been shown to lower hospital admissions and improve your overall well-being. Preventive measures like quitting smoking, avoiding pollutants, and getting vaccinated against flu and pneumonia are still essential. These steps directly reduce the triggers that cause flare-ups. For patients with severe disease, advanced non-invasive ventilation devices are now smaller, quieter, and more responsive. These devices help support breathing and prevent complications. Finally, understanding how long it takes to recover from a flare-up helps guide treatment. Most people need 4 to 6 weeks to fully bounce back, but some may not regain their full lung function even after 3 months. Early intervention and prevention are key to minimizing the impact of future flare-ups. All these approaches work together to shift the focus from just managing symptoms to actively preventing flare-ups before they start. By combining new medications, personalized care, lifestyle changes, and innovative technology, we're making it easier for people with COPD to breathe easier and stay healthier longer.